Good morning, everyone. This is Joshua Christiana from the ARC New York. I'm the Director for Quality Improvement and Compliance. Thank you for joining us this morning to talk about emergency preparedness and how to build a successful emergency management program. I'm joined here by Akila Scarrett-Bannister, who serves as the Disaster Preparedness Program Representative with the Emergency Management Division of OPWDD. Akila, if you wouldn't mind giving a little background about yourself.
Hello, good morning, everyone. Again, my name is Akila, and I'm here today to speak to you guys about how to build a successful emergency management program as it relates to the CMS federal ruling. Just a little background about myself. You might detect a hint of an accent, and that's because I'm from a two-island state called Trinidad and Tobago, located in the Caribbean. And, I came to the United States for undergraduate study in North Carolina, made my way up to New York to study my graduate degree at Columbia. And it was at Columbia that I started in the field of disaster preparedness and doing research around folks who were impacted by, really bad situations. So Hurricane Katrina was one example. And I did a lot of research around recovery and resiliency of vulnerable populations, and more specifically, children. And then after I was, finished with that, I volunteered with Red Cross, became an EMT, and now I'm here working for OPWDD in the emergency management field. So I'm excited to be here today, and hopefully you guys can take something from what we'll be discussing, and I look forward to any questions that you may have.
Thank you, Akila. So just a few housekeeping items before we get started. So the webinar is being recorded, and we will send a link out to all the participants following this. We'll also have it posted to our website so everyone can review it at a later date. If you have a question, we ask that you enter your question into the question box. We will periodically pause to look at the questions, see if anyone has anything they're interested in getting clarification on, and we'll do our best to answer your questions at the conclusion of the webinar as well. So a few objectives for today's webinar. We reached out to chapters back in December 2017 to find out where everyone was with their emergency preparedness plans and compliance to the ICF, to the CMS rule for ICFs. And some of the feedback we got was that chapters are in different positions in terms of how ready they are for the rule. We did find that many chapters have solid emergency plans and communication plans, but there was a lot of interest in additional information on things such as the hazard vulnerability analysis, which is essentially a risk assessment to determine your hazards that you should be addressing. We also got feedback that there was a need for information on shelter-in-place evacuation and relocation plans, which is an element of the CMS rule that's required. Some more information on the communication plan, specifically how chapters should work with their local county emergency management programs. And we did hear a lot about the need for information on training, testing, and exercise programs, which again is another required element of the CMS rule. So Akila is going to go into depth on those elements. So we're going to start with an overview of the emergency rule. So just some background information on the ARC New York and our ICFs. This is data as of December 31st, 2016. We had 10 chapters report ICF operation with 411 individuals served. And you can see that it's spread out across the state, but a good portion of our services for individuals in ICFs comes from the metro region and Western New York. And geography does come into play when you're doing emergency planning, because it will determine which risk areas that you may have to prioritize. And Akila is going to look at that a little bit when we look at the HVA. Just a note that some of the chapters have reported that they have an intention to convert their ICFs during the 17-18 and also the 19 period. So background on the rule is that this is not a completely new set of expectations. In the federal regulations, as part of a condition of participation for ICFs, there's a requirement, there has been a requirement that facilities would develop and implement detailed written plans and procedures to meet all potential emergencies and disasters. And things such as the fires or severe weather events, missing individuals. So that's something that has been in play for many years. Chapters have done a nice job making sure that they've had plans to address those scenarios. The new aspects of this is that the ICFs are required to establish and maintain an emergency preparedness program. So it's more than just a plan, it's an actual program. On September 8th, 2016, CMS finalized the rule, and they required full implementation 1 year, a little over a year later, by November 15, 2017. And we have seen some activity and surveys in this area, so we're going to look at that in some upcoming slides, but there are some required elements that you should be aware of. So you're required to have an emergency response plan, and as I mentioned, our chapters have done a nice job for formatting that and getting it set up. Policies and procedures to address emergencies, a communication plan, and a training and testing program. And this slide kind of lays out the layers to each of these areas. We're not going to spend a lot of time on the emergency response plan or the communication plan because, again, the chapters have done a nice job getting those together. We will have templates for the response plan, the emergency response plan, and the communication plan that we're going to share after this presentation, so you'll be able to get a little bit more detail on those areas. There are two additional components that the rule brings into play that you'll need to be aware of. Continuity of operations, or the COOP plan. This is sometimes contained within the emergency plan itself. Akila is going to offer some additional details on what continuity of operations is. And then, as I mentioned earlier, the policy and procedure or plan for addressing shelter-in-place, evacuation, and relocation during an emergency. These are two elements that were added on as part of the rule. As I mentioned, we've started to experience some survey activity out in the field. OPWDD has conducted, as of March 2018, 3 surveys that we've become aware of at our chapters. And we've done a nice job with these survey results. We've only had one survey come back with actual identified deficiencies. And the deficiencies were in areas related to the process for collaboration and cooperation with local, tribal, regional officials. So your communication plan has to detail how you're going to cooperate or collaborate with those officials. You need to have contact information with them. You need to show that you're actually connecting with them as you prepare for emergencies. We also had a deficiency in the area of a process for the safe evacuation from the facility. So again, making sure you have an evacuation plan, a relocation plan, shelter in place, all of that has to be detailed out. And then the other 3 deficiencies, one of them involved the system for medical documentation and maintaining that. It's critical that when an emergency happens and systems go down, that you're still able to maintain all your medical documentation as you did prior to the emergency. People are going to end up going to hospitals. You're going to have to do medical care at the facility. So you need to be able to access those records, and you also need to maintain the confidentiality of those. HIPAA still applies during an emergency. Again, the communication plan came up during the survey. There was a lack of contact information for the State Licensing and Certification Agency, or otherwise known as OPWDD. And then we were also cited for not including a method for sharing information from the emergency plan with residents and their families or representatives. So the emergency plan has to be shared with the families and their individuals, or at least the information from the plan needs to be shared. So I'm going to turn it over to Akila now, who is going to get into the details of the emergency program. But before I do that, I'm just going to take a quick moment to look to see if anyone needs any clarification on the brief overview that we gave. So I'm going to put everyone on mute for a second and check the questions, and we'll be right back. All right, so no questions yet. So we're going to move on to discuss the hazard vulnerability analysis.
Okay, so with the HVA, traditionally known as the hazard vulnerability analysis, is basically us trying to understand what that potential risk is that could impact your facility and your community. And its goal is to understand the threat, how often it occurs, and the impact that it has on your facility. And it's utilized for a number of reasons. So it helps to quantify, rank what those hazards could be. And we're going to do a small little demonstration of how to do that using a tool that we have acquired to be able to do our own assessment at OPWDD. It's used in emergency response planning as well. It's used for mitigation prevention planning. So if you know that you are more prone to floods or whatever else, you can have systems in place to help prevent your facility from being flooded. It helps in continuity planning. I will definitely go into detail in terms of what that means. And it also helps in your training and exercise design, because you have to train your staff according to the hazards that are most likely to impact your facility. So the HVA is a really critical component before even starting to write anything. It's that thing that you do prior to understanding what to put into your plan and how it will be helpful for your facilities and for your staff and for the individuals that you serve. So the two major components of an HVA is the hazards, of course, and looking at how likely they are to occur in your community, and then also assessing what you already have in place, what resources, your capabilities that are available to address whatever this threat might be. And so those two things feed into you completing your HVA. And this slide here is just to kind of understand what hazards you could potentially have in your community. So I've broken them down into three big categories: natural, human caused, and there's the technological component. So an example of natural would be severe weather. So a lot of times in upstate New York, we are more prone to snowstorms, winter storms, whereas down in New York City it's hurricanes. Human caused is more intention based, so there's an intent to do harm, and so that may be an active shooter with a weapon. And then with the technological component, there is a human error associated with it. So one example would be train derailments as it relates to transportation accidents. So those are some of this slide is just basically showing you what are some of the potential hazards that your community may face at some point. And then, I mentioned what your capabilities or what your resources are. So this slide is just kind of showing you an example of what those could be. So you depend on your emergency and your continuity plans. Your resources would be your staff, the people who are on the ground, being able to provide assistance to the individuals. Your communications, your equipment, your assets, and then also the external partnerships that you have developed over time with your local county officials. So your 911, EMS, fire, police, your county departments, Department of Health is a great resource in terms of knowing what to do in the event of something happening, and also your local Office of Emergency Management. And also other voluntaries that you have built relationships with, because you can start sharing resources with them. So this is just to kind of help you when you're building out the HVA, the things that you will be looking at. So discussing with facility staff what the facility-based hazards may be. So that might be care-related emergencies. Any type of equipment or utility failure, which includes, power, water, gas, interruptions in communications where cyber attacks may impact your IT system. Loss of, a portion of your facility as it may relate to a tornado or severe wind. Could be something that we have, I'm from the Finger Lakes region, and wind damage was a huge deal last year and also this year. And then interruptions in normal supply of essential resources such as water, food, fuel for like your cooking, for your generators if you do have those, medications, and also medical supplies for our individuals. And this slide, I mentioned before that, we are using a tool to be able to know how to quantify the risks that we may have. So Josh is going to pull up an Excel file. And this is something that, it takes some time to develop something like this. And so you have to put a lot of thought into how you want to be able to document assessing your risk. So what I'm going to do is just kind of go by column in terms of what the information you're seeing here. So again, the first thing is knowing what that hazard may be. And so, we've broken it down into natural and man-made hazards. And so I'm going to go through and then we're just going to highlight two emergencies that, we may see in our regions. The probability is, again, the frequency and how often that hazard may occur. And so we're ranking them based upon low or high probability. And then we're going to talk about magnitude and capability, which feeds into knowing what the severity of that hazard is. And the probability and severity now will be used to assess what your risk is. So risk would be the probability times the severity. Severity now looks at scope, the magnitude looks at the scope, the onset, duration, human impact, property impact, and agency impact. So the scope is for the area that it can affect. And basically, if you live in New York City, your region is definitely much higher, but bigger, sorry. And then we're going to look at the cascading effects. And so cascading effects is basically what can happen as a result of that emergency. So for a hurricane, we may see a cascading effect in terms of power outages. We may have flooding that may be the result of tropical storm surge. And then the onset is looking at the warning before the hazard strikes. So with hurricanes, we tend to get enough warning for us to know whether or not we need to relocate our individuals, get them out of harm's way. However, for a tornado, there really isn't much warning that can come. And so, you want to assess what that looks like. And then the duration of the hazard. Sometimes hurricanes can definitely last a really long period of time, whereas a tornado is something that goes by really quickly. But, even after the hazard has passed, how long can emergency operations continue? How long would they have to stay with you to help you recover from that hazard? And then we're looking at human impact, property impact, and agency impact. So human impact is the possibility of death. If you're given enough warning and you're able to get people out, that number tends to be much lower. But with a situation like a tornado, that number may actually be higher because, a tornado has such broad impact in terms of the number of people that can be affected. And then agency impact looks at the disruptions to essential functions and services. So this is where your continuity plan also comes into play, because you need to know, what those disruptions are and how they can affect your delivery of care to your individuals. And now we're looking at capability, which is in the gray column. And with capability, you're looking at preparedness, your internal response, and then external response. So external response is what the assistance that you will get from EMS, from fire, from county officials. And with the preparedness, with hurricanes, we tend to be more prepared for those because, especially if you're in a region where it happens more, there's more pre-planning that can occur to help mitigate any impact that it may have. But however, with a tornado, there's really not much you can do except for ensuring that your staff is trained and in terms of knowing where to take people to be safer. And And then with internal response, you're looking at, the timing of your response and the efficacy of it and the resources that you have available. And then, as I said, with external response, you're looking at your community and the other voluntaries that are there. And so we kind of did an example of, comparing hurricane and tornadoes. So I'm going to use the metro area because you guys have more facilities there. So hurricanes, tropical storm surge, this is something that happens pretty often for you guys. And so when we're looking at the probability and severity, the probability of something like that happening is pretty high because it's something that happens every year, multiple times. And so the number will be higher for that. And then as we go across the row, we have scope. Metro is a big area, so there's a higher impact in those areas. The cascading effects will also be pretty high because with any type of tropical storm surge, there comes flooding and there's infrastructure damage. With warning before, you have greater warning when it comes to hurricanes. So, we kind of rank that to be a 0 because you have enough time to kind of like get everyone to safe ground. And then the duration, and for the EMS operations, continuing, it's kind of, high and also moderate because the hurricane would last for a pretty long time and you will need, more response efforts in place and to be there for an extended period of time. And so that's why those numbers also got high scores. Human impact with hurricanes may be low because, as I said, you can get everyone to safety. There isn't any perfect situation, but ideally this is how we want people to start thinking in terms of assessing what that risk may be. And then of course with a hurricane, there's huge property impact and there will be disruptions to services for folks. So, and then we look at the capabilities. Again, you're able to plan better. So that number will be pretty low, which it should actually be a 3.
Let's just switch that.
Yeah. So this is we're kind of going through, and you can see how that number will change now because we ranked it at a 3. The internal response and external response, we give those like a moderate score. So now we see that the risk for a hurricane is pretty high. So now you can dedicate a lot of planning to be able to reduce the impact that a hurricane may have in your facility. And then, we do tornado and we see, in the metro region, a tornado may not be something that occurs. I know in Brooklyn, we've had a couple tornadoes, that have landed. And so when we go through and we assess what those numbers look like, we see that with hurricanes, we probably need to put more effort into, planning for it. Whereas with a tornado, it has, it's a 22% relative risk. So, you can still start thinking about how you can reduce those numbers. Now, if you were to flip that for like the western region, where we don't really see a lot of hurricanes, we may have some impact from them, based upon how wide it is, but those numbers would actually be flipped now for like the western region. And so tornadoes may actually have a higher rank than hurricanes for, areas that are not really prone to tropical storms or hurricanes. So this is like a down and dirty, quick review of how to go about doing your own HVA. And, we also have spreadsheets there that shows, what the top 10 or top 5 hazards you may have. And CMS wants to see this information in your emergency response plan. Because you can't write your plan if you don't know what your hazards are and how to prepare for them and plan for them and respond to them and also recover from them. So this tool, I think, is critical in terms of knowing how to put together your emergency response plan. So that's it for the HVA. Does anyone need any clarification on the information that you're seeing so far?
So just a quick note on the HVA. We're going to provide you with the template HVA so that you have it to be able to fill out. If you're familiar with a risk assessment for compliance, it's very similar in the way that you carry it out. You're prioritizing your risks, as Akila mentioned, and then those are built back into your plan so you know where the resources can be allocated correctly. So let me just advance back to the presentation. All right, and then we're going to take a second to see if there's any questions, and I'm going to mute everyone for a second and we'll be right back. So we do have a question related to the HVA. How is the risk calculated?
So as I said before, the risk is calculated based upon the probability and the severity. So if you could just pull up so risk is actually the probability times the severity. So, you know, if you just okay, so it's already there. So in the risk column, in the where you see the equal like information, it shows you kind of like how to do your calculation. And again, this is already done for you. So when Josh sends you this template, all you're doing is just plugging in those numbers there, and this spreadsheet will calculate what that risk would look like. So it's just a matter of just data entry at this point, and this really makes it easy for you in terms of knowing and assessing what your risk value looks like. So again, it's a pretty easy tool to use because the calculations are already in there.
Okay, and I don't see any more questions on HVA. If you do have a question related to this, feel free to enter it into the question box and we'll answer it at the conclusion. All right, so we're going to move on now to policies and procedures.
So some of the things that CMS is looking for specifically in terms of policies and procedures are these 8 categories that you're seeing here. You know, I'll kind of like highlight 3 things that I think, you know, you guys may not necessarily be thinking about. The other things I know you already do a great job at. So subsistence needs. So CMS wants to see an inventory of your emergency supplies. So that would be food, water, and, you know, if it like for power outages, flashlights, batteries, blankets, anything that would help keep during the shelter-in-place phase, help keep the staff and also the individuals more comfortable. And the standard has always been 72 hours, having a supply of food and water for about 72 hours, but we're also seeing data to support having something for about 7 days. So ensuring that you have enough supplies on hand to be able to ensure that the individuals are comfortable, that their needs are met. And then, you know, in the poker that Josh highlighted, sharing of plans with family, if you can put in some type of policy in place where families can get access to the plans that you have in place, and you can decide how to do that. One of the things that OPWD is thinking, like when there is that annual review of the individuals, like medical and what their needs are, the sharing of the plans can occur at that phase. And why is this important? So we've seen with school shootings, for instance, a lot of times parents kind of rush to the scene to see what's happening, to see if their children are safe, and expect to kind of, you know, get into the schools or do whatever else. And, you know, you tend to put yourself more at risk, not knowing what the facility's plans are. So that's why it's really important to know what this is and to provide it to family members. And then there's something called the 1135 waiver. What that basically is it's something that can occur during a presidential declaration. It will only be activated during a declaration such as that. And it's basically where medical providers can practice outside of their jurisdiction. So we can receive doctors, nurses, psychologists from, say, Ohio, for instance, or even within New York State jurisdiction. So counties, practitioners could practice outside of their own county jurisdiction. So this waiver is really important, especially if we do have something that's more large scale, to be able to provide a resource for if our own system becomes overwhelmed. So that is pretty much it for policies and procedures. Does anyone need any clarification on anything? All right, so we're going to move on to facility communication plan. Now, this is something that I know a lot of your facilities chapters already have, but I just wanted to highlight just some new additions from CMS. So CMS wants to see contact information, a point of contact, telephone, anything that you could provide for like your local public health department, so DOH for instance. They want to see contact information for your emergency agency, so your county office of emergency management, and also for OPWDD. So just, basic information is all that they're looking for, and a point of contact and their telephone numbers. You don't have to, try and figure out too much beyond that. When we did it for OPWDD, it was just a matter of just doing a quick search online to figure out who those people are, and just doing it basic like that. And then also they want to see documentation and participation planning efforts. So what exactly does this mean? When you're putting together your training and testing program, you want to be able to involve your local county officials in the planning of that training and exercise component. So what I would call them is subject matter experts for your training and exercise program. You want them to be at the table to know this is what their procedures are for when they have to respond to an emergency. And having them at the table will be critical, I believe, in ensuring that your training and exercise program is done. You're basically crossing all your I's and dotting all of your T's. So this component, in my opinion, is a super critical part of it, because you can't assume anything when it comes to outside response to your facility. And so having them at the table from the beginning is really important. And then contact with other nearby ICFs. CMS has stated very clearly in their ruling that you cannot evacuate to an IRO. Like, you have to evacuate to a facility that has the same level of care, access to care that your individuals will need. And our ICFs, we definitely have a lot of medically frail folks, and so some of our IROs will not be able to support that. And so you want to be able to have contact information on whoever's at that ICF, and who you can communicate with when that time comes. And then primary and alternate forms of communication. So we have our landlines. A lot of times our homes will have that, but cell phones. Some of the things that ICF suggested were walkie-talkies, anything that will help improve the communication side of your emergency response. And emails, of course, if your systems are not done and you can have access to email. All of those are just things that they want to see in your plan, so that you have backups to your backups, basically, is all that it is. So the next slide, I just, kind of wanted to show you kind of how OEM can be a really helpful resource. And so again, you want to see the local contact information in the plan. You also want to look at the county's emergency response plans. So in addition to reaching out to them, knowing what they already do will help you in your own creation of your plans. I mean, we provide the templates to you guys, but kind of reviewing what your county is doing, I think, will really strengthen what your plan has. Also, OEM will have local shelter information in it, so you know where you're supposed to go in event of something happening. I know in Western New York, Erie County, for instance, has an app that you can access, sign up for, where you can get when like if there's a snowstorm occurring, that app provides every single thing you would need to know in terms of what to do. Now, it's not available in every county. Niagara and Erie counties are the only ones that actually have this app. But it's great. New York Alert is another one as well, where you can sign up for emergency notifications and see when something's about to come down the pipeline in terms of a hazard, and knowing what you would need to do and start planning and preparing for all of this. So all of this could be located inside of your emergency plan, and the templates will show all of that to you. And then also recent emergency events, like what they did when we had that snowpocalypse in Buffalo. So OEM is a great resource, and it's just a matter of reaching out to whoever the emergency manager is and building that relationship. And this slide is just Josh created this wonderful tool here where these are the these are the OEM links in our ICF facilities regions.
These are the for our ICF chapters at the ARC. This is where you would go to your county OEM to find the additional information that Akila was just talking about, their plans, the recent events. So this is a very good resource list for you. So you should take some time to go to those sites and explore as you develop your plan. So I think maybe we should see if there's any questions at the moment. So we're going to pause for a second and we'll be right back. All right, so we do have some questions. The first one is a request to please show the contact for OEM again. So I'm just going to go back to that slide. So that is the listing of the OEMs. And this PowerPoint will be shared following this presentation, and it does include the links to all of the OEMs.
And when you click on this link, it will take you directly to the Office of Emergency Management, where you can get the name and contact information for whoever the emergency manager is for that county. And we've interfaced with them. They're really nice folks, and they want for us to reach out to them because in their own emergency response efforts, a lot of them don't know where our group homes are located. And so they want us to start reaching out to them to say, hey, my group home is located at XYZ, and we have this number of individuals here with whatever access and functional needs issues that they may have. And so if they have that data, that information, their response efforts would be even more efficient. And so, it's just a matter of going to these links and just figuring out who these folks are.
And then we had a question, do you have policy and whole plan templates that can be shared?
So we have the plan templates, and with the shelter-in-place evacuation relocation, we've created a standalone document for that, and you can put all the information that you need in there to for your own plan. But in terms of like the policy documents, we did not create templates because I think that is something that's outside of the purview of OPWDD in terms of creating policy for other agencies. So that's something that we shy away from.
I will say that you can develop your own policy, taking the templates that we have and taking the information out of that and then building it to your own chapter profile. Each policy is going to be somewhat unique to where you're located, what staffing you have, what administrative positions, and what resources. So, one template policy wouldn't really work for all of the chapters. All right, so we are going to now move on to discuss the continuity of operations planning, otherwise known as COOP.
Okay, so I just wanted to kind of create a foundation for you guys to understand exactly what continuity is. The concept was first developed in the private sector, where it was more business continuity and the IT component of it. And what we've learned over time is that it's a great planning tool to have in place in order to know how to operate the business side of your chapters. And so, it is a foundation for the continuation of supports and services during a crisis. Leadership plays a really critical role in this because it is the business side of the response. So it helps understand what those priorities are. And again, it's a sound business practice. If you don't plan for how to continue offering supports and services, being able to, meet the needs of your staff, then I call it you're in for a world of hurt. And so it's really important that you have this component in there. And then what is COOP? Basically, it's the recovery planning component of it. When you activate your emergency response plan, you activate your COOP plan as well. because it helps to, understand what you need to do in the event of something happening. So it helps in recovery planning. It also helps to address what we call in emergency preparedness, well, mission essential functions. And what that is that, it's those essential functions that directly provide the supports and services that you would need to continue providing care to your individuals and also care for your staff as well. And then it assesses the daily, weekly, and monthly essential supporting activities. The essential supporting activities are those functions that support your mission essential functions. And, just to quickly give you an example, paying staff. That's a really critical component because if you don't, then they're not going to show up for work. So having something like that in place, when you know all of your systems are down, how would you still be able to deliver the support and care that you need for everyone involved? And your own ARC chapter COOP, basically it's ensuring that you continue the high performance that you can do outside of an emergency, and is being able to deliver those mission essential functions to everyone involved, the individuals and also the staff. And it follows the all hazards approach. So when we did that HVA, there was the agency impact component of it. This is where your COOP plan again comes into play, and it's so knowing, whatever hazard there is, this is how my business will still be able to continue operating.
So we're just going to look to see if there are any questions related to the COOP plan. All right, we do have a question related to the COOP plan. So are there any good COOP plans you can offer as an example?
So one of the templates that we will provide is the one that we've done for OPWDD for regions. And, I think it's a great resource for you guys to use as you're putting together your own. And, after we address any questions that you guys have, I just kind of created a scenario of when to activate your COOP and how to do it. So I'll kind of go through that. And also, again, we have the templates for the COOP available as well.
Okay.
So here, we've kind of used flooding as a scenario. So where you see 29 British American Boulevard, that's where Josh, myself, and Eric are located. But just replace this with your own facility, right? What would you do in event of there being a flood at your facility, where you've had to close your offices and people cannot come into work? Again, we're looking at the business side of everything. So I just want to make that clarification. So these are the things that you want to be thinking about as you're building out your COOP plan. Where would you go in event of something happening? Where would staff still be able to come into work and still be able to do their job? Are they able to work remotely, from home? Do you have a specific facility that you can think of where, it's outside of the emergency itself and people can still, come into work and do what they need to do? What are those essential supporting activities that need to be carried out? Who needs to be there? If a supervisor or, the director isn't able to come into work, who can fill that void in the event of something happening? Which systems need activating? A lot of this is more IT specific, and so how would you still continue to be able to pay staff? Email access, is that something that you may end up losing as a result of the emergency? So can staff still access their email systems? Tabs is another one where DQI and facilities are able to track medical information of the individuals. All of those systems would need to still be operating even if there was not an emergency. And so they'll even be even more critical when there is that emergency occurring. And then what are the logistical needs of your facility? So those are like the 5 main broad questions that you want to be thinking about. And so this slide kind of gives you an example of what your mission essential functions would be. So healthcare service delivery, access to health workforce, I listed out, about 7 things on there, and I just wanted to kind of explain to you what the mission essential function would be and what the essential supporting activities would look like. So for healthcare service delivery, your mission essential function would probably sound something like this: the provision of healthcare continuity to provide it to all of our healthcare environments. And then essential supporting activity for that would be determining the extent of disruption to healthcare service delivery. And also another thing that you can be thinking about is determining if relocation of healthcare service delivery to alternate care sites is an option for short-term communication of service. So those 2 things feed into your mission essential function, and you're able to assess whether or not it can happen. Another one is access to the health workforce. So the mission essential function would be the ability to deploy a credentialed health workforce to provide patient care to support healthcare service delivery in all environments. And then the supporting activities for that would be identifying medical and non-medical staffing shortages during response and continuity operations. Also, recalling additional staff incrementally to assist in disaster continuity of operations. And just kind of like on a side note, I'm always a proponent for how can you ensure that your workforce can come into work. So this is also on the, field staff that are there, ensuring that they have a family communication plan in place to be able to make them feel comfortable about coming into work. If they know that their family is safe as well, then the likelihood of them saying, okay, I think I can show up because I know my family is safe, increases the probability that they will. So I'm a strong advocate for ensuring that you have some type of training or policy or whatever there is to be able to provide that as a support to your staff. And then, looking at the healthcare information systems. So a mission essential function can be coined as this: fully functional information technology and communications infrastructure that support high availability of the healthcare sector's data management and information sharing capability. And so the essential supporting activities for something like this would be determining the extent of disruption to communication or information technology capabilities at your facilities, and also activating redundant communication capabilities if necessary. And then with the healthcare administration finance component, the MEF would be fully operational administrative and financial capabilities, including maintaining and updating patient records, adapting to disaster recovery program requirements, payroll continuity, supply chain financing, claim submission, and losses covered by insurance and legal issues. So that's what your mission essential function would be. And the activities to support that would be modifying and maintaining healthcare information management practices according to changing program requirements directed by authorizing entities. The other one could be coordinating the use of paper systems to track patients, health issues, and other critical data in the event of electronic systems are compromised. So that's kind of like a really basic, it's a basic, overview of, sorry about that, a basic overview of what your continuity plan would look like, what it would entail, and the information that you need to have in there. So at this point, if anyone needs any clarification or anything, I am more than happy to provide some insight.
So I'm just going to check to see if there are any questions. Okay, no questions on COOP, so we're going to move on to shelter-in-place, evacuation, and relocation plan.
Okay, so again, we have the templates for this, but I just wanted to just briefly kind of go over what you need to be thinking about as you're building out your shelter-in-place and your evacuation relocation plans. So the decision is whether or not you should stay or if you should go. And so this graphic here kind of I think streamlines kind of your thought process in terms of how to assess what that is. So what are the factors that you need to consider as to whether or not you need to remain at your facility or if you need to leave? And so, what was created here was kind of like a tiered system. So is it safer to stay or to go? Is it safer to shelter in place? Basically, is what that is trying to figure out for you. And so, as you're deciding whether or not to do that, you're looking at the physical, if there's any physical damage, or if there's any temperature issues at your facility. And so, if you've decided that it's safer for us to leave, that's where you now evacuate. And as you're evacuating, you now have to assess whether or not, how long will this evacuation have to take? Is it something that can happen in one day, or is the facility still unsafe for re-entry at that point? And so if you decided that it's more unsafe for us to, kind of like hang around our facility because we're not going to be able to get back in, now that's where the relocation component comes into play. And then, this decision tree kind of like showcases to you what you need to be thinking about. And then, as you build out, again, these templates are available to help you put together what your plan is. But with shelter, you want to know what your preparedness actions are for sheltering in place. You want to look at actions taken during the event and also to be taken afterwards. And so with shelter in place, having that inventory on hand of emergency supplies. And then there's something called the safest room. What would the safest room in that facility look like? The definition for the safest room is a room that does not have any windows in it, and it's also not on an exterior wall. And so a lot of times we find bathrooms an example of the safest room, or even a closet. So this becomes really important for something like a tornado, for instance. Some of our facilities may not have basements, right? So I know in New York City, we don't have basements. A lot of our homes will not have basements. So you have to identify what that room would look like and the staff that you would need on hand to be able to help move folks around. And I know, in Metro, for instance, where, there's a huge capacity in terms of the people, you just kind of have to figure out what that room would look like. And then in evacuating, most important thing for this is being able to track the staff and the individuals. And then in relocating, having the necessary, equipment that you would need to be able to take with you. So go kits, knowing what your primary and secondary relocation sites are, what your evacuation routes are. That's really important because a lot of times if there's a massive emergency, some of our roads may be closed off. And so you need to assess what those routes would look like. Also, transportation plans is another thing. Knowing the number of vehicles that you need to have on hand to move your individuals, and also, what their needs would be. And then tracking of staff. So there's, you can do it, a paper version of it, or, OPWD is going to be using something called e-fines. And basically it's, and I'm not sure if you guys already have that or know what that is, but it's a tracking system that we're going to be using where our individuals will have bracelets that we can, there's a barcode on that bracelet, and it's just a matter of putting that data into an Excel file and tracking our individuals that way. And it's done through the health commerce system. So the health commerce system is activated to be able to, and it's only done for really large scale emergencies as well. And then having a return home checklist. So, you're checking, like if there's any damage to your facility, or, you've run out, your emergency supplies have run out, you need to restock. Things like that you need to be thinking about in terms of being able to return back to the facility itself.
So we're going to see if we have any questions about shelter in place. All right, we do have a question. Our agency has multiple sites throughout Westchester County. All are in different towns and municipalities throughout the county. Our county OEM requires each municipality to create their own evacuation plan. Some of these municipalities have a history of not being accessible. Each town is different. What do we do?
Okay, so this question actually is not an easy question to answer because this is the difficulty for a lot of our homes and where they are located and how spread out they are. But I think in terms of how CMS has laid it out, if you factor in place what those evacuation routes would look like, what your alternate facilities are, they want for us to at least at a minimum, like within 50 miles of your facility, know where you can evacuate to. And if you have to leave outside of that 50-mile radius, where else? And again, it all comes down to having communication with even outside of your region, right? Outside of your county, building those relationships with your other ARC chapters so that you can, in the event of something happening, be able to evacuate to wherever they are as well and having a plan in place for that. And this can be captured in your shelter in place and evacuation plan. We've really thought out in terms of how we want to be able to capture this information. And I think the template that we will provide to you guys would really start, helping you plan it out, play it out, see how you can really customize it based upon where you're located and especially if it's multiple facilities. So.
All right, we're going to move on to training, testing, and the exercise program.
So this, to me, is the most critical component of a plan. We have seen throughout time that plans sit on bookshelves, they sit in drawers, and no one ever reviews them. They just write them, and that's basically it. But in order to know if your plan is working, if it's correct, if it's accurate, you have to test it. You have to train for it. So I know, OPWDD, we have excellent fire drills for our homes, right? But as we're seeing in our world today, it's not just fires we need to be thinking about. It's other emergencies that we need to be thinking about. And how do we train our staff to be able to know what to do in event of such things? And also operationalizing those plans, right? Knowing what to do to ensure that the plans can actually, if they make sense. And so the only way you can do that is by exercising your plan. So the main purpose of it is to protect your staff and their welfare, and the individuals and the staff and their welfare. And the goal of it is to be progressive in terms of how you build it out. So you have your training and you have your exercises, and it's not just one exercise that you should have. I advocate for having multiple exercises that can build up to like a big type of exercise. So I'll also go into detail what I mean by that. The exercise in your plan evaluates your readiness, and it also helps highlight any gaps or weaknesses that are in your plan, so in your communications, or even when you're ready to evacuate folks. If you're able to test what that looks like, then you're definitely making waves in terms of how to do it effectively and efficiently, and how to implement it by conducting workshops, orientations, having drills, briefings. All of those things help evaluate what your readiness would be. And then there's the improvement planning component of it. So even after you've done the exercise, you need to see if that exercise actually did work. And the only way that you can do that is by capturing all that data in something that we call after action reports. And so these after action reports now help you to be able to update, which you're supposed to do annually, update those plans that you have in place and to showcase any gaps or weaknesses in it. And so the CMS requirements for your training and exercise program. So for training, they're advocating for it to be done, whatever your training might be for new employees. And so what we as OPWDD, what we're planning on doing is having hazard-specific training. So we've created flip charts, emergency response guides for our facilities where we're going by hazard and telling them these are the response actions that you need to be taking. And you can do these trainings for new employees and also annual refresher trainings for staff that's already there, so that people are constantly knowing what to do. And even, I don't know the terminologies that you guys have here at ARC, but the TTLs, the treatment team leaders, they are going to also be doing trainings with their staff at their facilities as well on these hazard-specific emergencies. And so you have to always be keeping people abreast of what's happening, what they need to be doing in event of a specific hazard. And then you also, a really critical thing as well that CMS is looking for is ensuring that there's documentation of these trainings. People have been cited on this. And so if you don't show that the training has been conducted, CMS would know that, and so they will definitely ding you if you don't have some type of tracking system in place. And then for the exercise component of it, the exercises basically is testing what your capabilities are, what you're able to do in the event of something happening, and they are to be done annually. And so CMS is requiring that you do a tabletop exercise and also full-scale exercise. And what I would, advise or beg of you to do is not just have one tabletop exercise, because one exercise is not going to show you what you need to be doing to build up to a full-scale exercise. And with the full-scale exercises, they want to see either a community-based one where you are working with outside agencies in the response aspect of it, and also you could do a facility-based one where it's just like the internal folks, you're activating resources, and so it's just looking internally as to what that will look like. So with the full scale, and you'll see like what that means, right? It's activating your resources, moving folks. It's not an easy exercise to do. It requires a lot of planning, and so that's why, having multiple tabletop exercises and having workshops, drills will help you when it comes time to do that full-scale exercise. All of those prior exercises will feed into this and will help you do one that is successful. And then an actual emergency does count. And so if you've had to relocate folks, evacuate folks because of something like a flood, for instance, that would count in CMS's eyes. But you have to document all of this, right? You have to show them that it was done. So any lessons learned from any of these exercises will count in even the actual emergency. And having those after action reports as well as part of your documentation would be really helpful. And again, we have templates for all of these things to provide to you guys.
All right, so we'll just check to see if there's any questions quick on the training program. All right, so we're now going to talk about our final portion, which is operationalizing your plan. We're going to walk through a quick example of what it would look like in action.
So I decided to do a tabletop exercise because it's a pretty basic one. So when you do a tabletop exercise, you want to make sure that you have your objectives in place, and then you decide what your scenario is going to look like, and then figuring out who's going to be there to help you with your exercise. And so with design objectives, you can either be testing out your communications, or you can be testing out your shelter-in-place relocation evacuation plan. So there are different components to your emergency response plan that you can test out. And then the exercise scenario could be something in terms of, there's a potential hazard that, will causing your facility to evacuate or shelter in place, or there's some type of hazmat release in the community, and so what would your facility need to do? Or there's a potential for mass casualties depending on whatever that hazard is. And then with the exercise participation, so it's broken down into 4, well really 5, but you have your players who are actors. Actually, those are the people who would actually have some type of role or responsibility in the if there was an actual emergency. And then you have your controllers who are, these are the people who plan and manage the exercise. And then you have your evaluators who are most times subject matter experts. So they could be someone who understands ARC itself, and also people from outside in the community that can come in and help you evaluate. And then you have observers who are just people standing around, and after the exercise can provide feedback on whether or not it was a good exercise or not. And so this slide is basically kind of an example of what you need to be talking about for your tabletop exercise. So the tabletop exercise is a discussion-based exercise. And so the words that are in bold are what we call injects. And basically, someone will be kind of putting these injects out, and it's done over a certain time period. So you can start it at 9 a.m. And then for the second one, it could be at 9:10, because you also want to ensure that, if there's a time component in terms of how quickly you want your staff to respond, you can time it based upon these injects. And so the questions are basically trying to assess, what actions need to be taken and who needs to be contacted, who's going to be taking on a management role, all of these things, what resources need to be activated, all of these things that you need to be thinking about as you're discussing what your chapter agency is going to be doing.
So you can design any tabletop exercise you desire based on any hazard that you identify through your HVA as you do your risk assessment. So this is just one example, and we chose a fire essentially because it was fairly common to deal with. But this is basically the layout of how you would design a tabletop exercise. And it's really essentially a discussion with the chapter leadership, the people that are going to be involved in the actual emergency plan when it's activated. So again, feel free to kind of use this as a model or take one, design your own scenario. But the key here is that there's going to be questions that you should be exploring as you look at each individual hazard. And some key takeaways from today's presentation. We just want to make sure that everyone understands that there's no single path to effective emergency preparedness. Really, there's a variety of ways that you can attain success in this area. The core responsibilities under the CMS rule are going to be the same and they must be met, but it will differ based on the chapter profile, you as an organization, what resources you actually have available to you. Chapters have different levels of staffing, different skill sets in their staff, different treatments that are required for the individuals they serve. So again, your emergency plan is going to be different based on your organization. Don't recreate the wheel. So there are a number of chapters that already have emergency preparedness programs in place with solid emergency plans, solid policies and procedures and communication plans. We don't want you to have to start from scratch. Again, that's why we're going to provide you with the customizable templates. But if you've got something that's really working and you've had a survey and it's gone well, there's no need for you to restart everything. You really just want to build on the good work that you've already done. Again, the customizable templates will be coming out in the next few weeks, and you can change the language in them to meet your profile of your organization. And just consider that this may be of use to other providers outside of the ICFs. So if you operate IRAs, DAHABs, you can take some of the material from the templates and use that to build some plans for those locations as well, because really you want to make sure that your emergency plan touches kind of on all of your programs and your facilities. And lastly, just remember that this is a good opportunity, given the limited resources that are out in the current environment, for chapters to explore sharing resources. That could be things such as communication technology. You may have plans that you can share with another chapter that they may not have thought of. So again, I think it's worthwhile to reach out to your fellow chapters to see what they're doing, see how they're activating their plan, what drills they're running, what training they're doing with their staff. All of those things can be useful. So we have a few next steps. Again, the templates will be coming out, and on this screen you can see the templates that we are going to have available for you that you can build based on your chapter profile. And then OPWDD is looking to do some workshops. And Akila, if you want to talk about that a little bit.
So this is stuff. This is stuff that's still coming down the pipeline, but we would want to assist you guys. I'm sorry. to assist the chapters in terms of building out a training and exercise program. So we would want to conduct a workshop with you in terms of how to effectively do that, and also if you need assistance on the HVA, having a workshop for that, and also the COOP as well. So all things coming down the pipeline. It's going to take some time, but it's things that we are thinking about providing as a resource to everyone.
So we're going to take a second to look to see if there are any additional questions. If we didn't get to a question, we certainly will reach out following the presentation, but let's just take a moment to see what we have. Okay, it doesn't look like we have any additional questions. So we would like to thank you for joining us today for the presentation. Again, this material will be up on our website, as will the templates. I'll send out the presentation in the next few weeks along with those templates. And if you have any questions in the meantime, please feel free to reach out to myself or to Eric, and we'll do our best to try to assist you. Thank you for joining us, and have a great day.